What to do when your child has roseola? If your child suddenly develops a high fever and then a pinkish rash, you might be dealing with roseola, a common viral illness in young children. It mostly affects kids under 2 years old. The key is to focus on caring for your child and watching for any signs of complications. Start by monitoring the fever closely. Use age-appropriate fever reducers like acetaminophen or ibuprofen to help lower the temperature and make your child more comfortable. Avoid giving aspirin because it can cause Rash syndrome, a rare but serious condition. Keep your child hydrated by offering plenty of fluids such as water, breast milk, or formula. Dress your child in lightweight clothing and keep the room at a comfortable temperature to help manage the fever. Since roseola can cause a rapid increase in temperature, some children may experience febrile seizures. These are usually brief and not harmful but can be frightening. Signs include jerking movements, loss of consciousness, or loss of bladder control. If your child has a seizure, gently place them on a safe surface, do not restrain their movements, and seek emergency medical help immediately. Watch for the rash, which typically appears as pink or red spots on the trunk and then spreads to the face, arms, and legs after the fever drops. The rash is usually not itchy and tends to fade within a few days. Other symptoms might include irritability, swollen glands, mild respiratory issues, or a decreased appetite. It's important to have your child examined by a healthcare provider for an accurate diagnosis. While roseola has characteristic symptoms, other illnesses can look similar. Usually, doctors diagnose roseola based on the pattern of fever and rash, and blood tests are rarely needed. Most healthy children recover from roseola without specific antiviral treatment because the illness resolves on its own within about a week. Antiviral medications are generally only used for children with weakened immune systems. To prevent spreading the virus, practice good hygiene like frequent hand washing and keeping your child away from others while they have a high fever. Your child is typically no longer contagious 24 hours after the fever subsides. In summary, when your child has roseola, focus on supportive care to reduce fever and keep them comfortable. Watch for signs of febrile seizures, observe the rash, and consult your healthcare provider for confirmation and guidance. Remember, most children recover fully without complications, but always seek medical advice if you have concerns or if symptoms worsen.